Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. That's Sunday.
Yeah.
Okay. That's
Sunday's where they have all.
Hello, welcome to the Becky and Boca Show. Tonight, I have my very own plastic surgeon, Dr. Arthur Handel, and I wanted to bring him on this month because 2 years ago, you did my whole face and my neck.
It went by fast, didn't it?
Yeah, it did.
Too fast.
It did. I'm getting older. So I wanted to talk about that.
Good.
I think it's holding up really well, and it was so much easier than I ever thought it would be. And I don't think anybody can look at me and think I had anything done. I think it looks very natural. So why don't you explain what you did to me?
Well, we did an endoscopic brow lift. That was one of the.
Oh, that was my favorite.
That was the first thing we did to give you the most natural, rejuvenating look to your upper lids because, like I explained.
And I had upper blepharoplasty before that.
Right.
But it was still sagging.
What happens is the brow is a key element because the brow gives you expression of happiness, sadness, tiredness. And if you just the upper lid, it can actually make you look worse. You'll have the skin off your upper lid, but it actually doesn't make you look rejuvenated.
Yeah.
It gives you kind of an odd look sometimes. So the best thing is the brow, and you don't want to elevate it too high. You just want to put it at the natural level where it was meant to be.
By doing that endoscopic brow lift, I know it opened up the whole top of my eyes. So you think people can do that in blepharoplasty?
Exactly.
On the top.
See, what happens, some people have hooded eyelids where they have a natural amount of hooding over their eyelids, and some people have hollow eyelids on the top lid. So I usually ask my patients, bring me a photograph from when you were younger because we're trying to restore you. We're not going to try to make you look different. And if you change the eyes, and there are famous celebrities who've had that kind of work done, like Renee Zellweger, where they made a big...
She doesn't even look like herself.
A big deal. If you change somebody's eyes, you change their expression, you can't tell it's the same person.
Closer to the mic.
So you can't tell it's the same person.
Yeah.
So the way to do it, if you have hooded upper lids and you start to see that aging process, what you really need is not an upper lid blepharoplasty. You need to have an endoscopic brow lift.
I know that.
And the beauty of it is very small incisions behind the hairline.
That was nothing.
No shifting of the hairline.
Two little holes up through my scalp here. And you put, I think, little tacks in there.
Yeah, they're called endotynes.
Dissolve.
They look like little carpet tacks with sharp prongs.
That's what they felt like.
And they dissolve after what, 2-3 months?
Yeah.
I think they dissolved. And you're able to elevate the brow without shifting of the hairline or hair loss or damage to the nerves. And it's one of the nicest operations that I perform. I really enjoy it because the biggest comment my patients tell me is that their friends and relatives will notice their eyes for the first time. They didn't even notice their eye color before, and they'll think, "Did you get contacts?" Or I never noticed your eyes.
No, for me, it was my makeup artist, Lisa. She's like, "Gosh, it's so much easier to put eyeshadow on you now."
To me, the eyes are the key. You have to, whatever you do with the rest of the face, if you don't address the eyes properly, you're really not getting the best results.
So that procedure, you can do that as a standalone procedure, right?
You could do it as a standalone procedure. That's one of the procedures we do on the younger patients. But usually when someone comes in for a facelift, they pretty much need the whole thing done. Unless, and I'll tell them, they're, if they're borderline and they can get away, we can do some things to kind of cheat. We can do a little fat grafting on the brow to raise the brow a couple of millimeters. So if it's a minimal amount, I always look for the most minimal amount of surgery. I don't look to do the most the maximum amount of surgery. So I try to do what's best for the patient. And what we do is we assess them. But if you don't rejuvenate the upper third of your face, then the rest of the face
doesn't matter.
It's
The
not.
same
You're
is
not
true
going
at
to
the
get
bottom of the face too, isn't it?
You have to. You have to.
You know what?
You have to match the top floor
you
with the first floor.
really good up here, and then. But see, okay, so what else did you want me? That was the
And then we did the lower eyelids.
right.
So
Okay.
we did a lower lid blepharoplasty with a suspension, so that you
Oh
don't.
yeah, you did something where you pulled the corners.
Yeah,
That
you
made a
have
huge
to do that
difference.
so you don't get that pull down look. If you notice that people had their eyes done, sometimes you'll see a little bit of a pulling effect where the too much of the white part of the eye shows.
Oh.
And that's kind of like a telltale sign, and that's something you want to prevent.
Yeah.
So we do a little suspension where we
You called it something.
canthopexy and a suspension.
Okay.
So what we do is we actually secure the corner of the eyelid, and we elevate the muscle, and we secure it to the bone so it doesn't pull down in your eyelid while it's healing.
Okay, that made a huge difference.
So
I remember
so
that
that
one.
and that
Yeah.
it also elevates the cheek a little bit. So some people get these little pouches. They're called malar bags or festoons, and the
Okay.
only way you could really get rid of that, well, one of the best ways to get rid of it is with that type of procedure. It's almost like a mini cheek lift.
Okay, just by pulling up the corners of the eyes.
Right.
Wow. Okay.
And then we did the face and neck lift, and that was to tighten up all the muscles on the neck and lift up the muscles on the cheek, and then we
Yep.
pulled back the skin, and we finished it off with a little bit of laser and fat grafting.
Yeah,
So
I got everything. But it was good, and the laser that resurfaced my whole skin.
Yeah, you weren't bad to begin with, and I remember it took quite a long time for your skin color to come back to normal.
Yeah, but I was out to dinner 8 days later.
Yeah,
I
yeah,
put
with
makeup on before I was supposed to.
Right, and some people they heal quicker than others. Usually,
Yeah.
the fair skinned patients heal a lot quicker
Yeah.
from the laser, but it
Really?
also depends on how deep you have to go. You know, when you have severe wrinkles, you need a more aggressive approach, and therefore the downtime is a little bit more. But usually, I notice the fair skinned patients they heal a lot quicker, and within
Oh, really?
3
I would
to
think it
4
would be
weeks.
the other way around.
No, because they have less pigment in their skin.
Okay.
And, you know, there are ways of preventing this, but, you know, you can't always predict 100% the way the human body's going to heal.
Yeah.
So that's why we can prepare your skin with a little bleaching cream. And there are things you can do, but eventually you get there.
Yeah. So, okay, so you did that. That was the laser resurfacing. And I remember I brought you on the show exactly 2 weeks later.
Right.
You were kind of scared because I was bright red. But I went to my girlfriends, Ivy and Lisa, at the beauty lounge, and they covered it up. So I was
with
able
great
to...
with good makeup, you can cover that. You
Yeah.
know, I love when I have a patient that I don't have to do laser on because the results are seen a lot sooner.
Yeah, they're
I mean,
out at
within
Publix the next day.
Yeah, I mean,
Yeah.
some of these patients, I mean, within a day or two, they look like they can go out in public.
Yeah.
And there are things that you can do to minimize bruising during the surgeries.
Like
so, well, I use a dilute solution of lidocaine epinephrine, so it's not that tough on your cardiac system, you know, as far as tachycardia and everything, but it makes the dissection easier and it really cuts down on the bleeding. And then you just have to do meticulous hemostasis. You have to really make sure that there's no bleeders afterwards, and spend a lot of time with that. And then post-operatively, you know, they usually do pretty well.
I remember running into a couple of patients in your office a couple of days later when I was there for follow-up, and I was bright red, and they were fine. They could go out. It was like, it was amazing. I was amazed
Yeah,
that...
the non-laser patients, they heal. Now, we have other technologies now that will resurface the skin and also help with the wrinkling and the texture of the skin with very, very minimal downtime. And it's all patient selection. Technology is good. It just depends on how you're using it and who you're
You got to
using
use
it
on the right
on.
person.
So
Yeah.
if you know how to judge that, you can get really good results. But you have to be, you know, have a good discussion with your patients. Education is very important. We see them twice before surgery, at least. And then we go over everything. We tell them, come back if you have any, write down your questions. We go over photographs. And,
Yeah, I thought it was interesting. You asked me for a photograph from when I was younger.
oh, yeah.
And you take those into the OR with you, right?
We always tell patients that it's like restoring a beautiful car.
And I know you restore cars.
Yeah, you have to have that. You have to go back to originality. And what you do is you hang that up in the operating room, and especially when you're done with all the surgical part, as far as the skin tightening and the muscle lifting, then you use the fat. And that's what's beautiful about fat, because a youthful face is not just a tight face, it's a fuller face.
Are any doctors still doing it without fat grafting?
Well, it's becoming more and more popular now.
Yeah.
So it's catching on. I've been doing it since I started my practice. And there were times when fat, they thought that it didn't last, and it was kind of put by the wayside for a while. And then it made a resurgence because it was actually proven that it does last. And then we've refined the techniques on how we use it and purify it. But it's got great things. First of all, it's in abundance. There's no allergic reactions to it. And it's got stem cells. So a year later, even on the patients who don't get laser, a year later, you'll actually see improvements in their skin.
In the skin. Okay, so you took some fat out of my belly, and where did you put it?
I put it on usually what we do is we put it underneath the eyes. It's they're called the tear trough, where there's a little depression.
Yeah.
Then we put it on the cheeks. We put it around the nasolabial folds, the jawline, the lips. Sometimes even the earlobes, because as you age, the earlobes thin out.
Yeah.
And we plump them up with a little bit of fat. We put them sometimes with somebody's nose.
I think you put a little bit
We put
in
a
my
little bit
nose.
of the nose. Yeah,
I remember that.
And it's almost like getting a little bit of a rhinoplasty.
Yeah.
Because that fat will take. And you could give the illusion of a straighter nose by adding a little fat. We do that with fillers, which can last up to 2 years. But with fat, it's more of a permanent thing.
Do you do fat grafting as a standalone procedure? Like if someone
Yes.
didn't want to,
Yeah,
someone
we
can
do.
just come in and have that done?
We look at everybody as a unique individual. And my goal is not to do as much surgery as I can. My goal is to give them the best result. And we take into account their health and their, the whole picture. So, if it's just a volume thing, then fat is the best thing. Like if somebody
You think
comes
that's
to me,
better than just doing fillers?
well, fillers. The great thing about fillers is that you just sit there in the chair and
Right, you come in and you get a little...
we get a great result immediately.
Yeah.
But I have a lot of patients who come in, and then by the time they tell me what their concerns are, you're talking about 4 to 6
A lot of
syringes of filler, which is a lot of money. I mean, even my cost of the fillers, I try to explain to patients, my cost alone is a lot of money and it doesn't even make sense at that point. And 5 syringes of filler is only 1 teaspoon. So if you put it in that
I know,
perspective,
people don't realize that. When you see it in a syringe, it looks like a lot, but
it looks
it's
like
not.
a lot. And it's a great thing. And fillers are great for people who don't have any fat to donate. Some of these people are very emaciated.
Who has
they're
no
very
fat?
athletic. A lot of people in Boca have
Well, that's
very
true.
little fat.
We're in Boca Raton.
They come in with their gym outfits and they eat healthy and they're very lean
Yeah.
But so fat is great because you can use it as much as you need. I mean, typically you can use 30 to 40 cc's, and that's where you restore the whole face. And if you look at especially on women, the jawline usually gets a little weak here.
Yeah, you put it along the jaw,
And
right?
when you fill that up, I mean, I very rarely use chin implants anymore because with the fat, it takes very well because there's a little muscle underneath the chin. If you get the fat inside that muscle, it gets surrounded by blood vessels and it integrates with it, and it lasts and
Wow.
it takes permanently.
Wow.
So
That's interesting.
fat does.
So you can kind of do a fat grafting facelift without any surgery.
Well, we call it the volume lift. Okay,
Volume
and
lift,
sometimes
okay.
we'll combine it with laser, or now we have the new technologies, which I'm kind of calling a hybrid lift because we're using fat grafting with technology, and sometimes even a little surgery. Like sometimes I can get away with just doing like a little neck lift or just doing a little platysmoplasty, just
Well, that's
tightening
what
up
women
the muscles
complain about
here.
the most. So if you have something, tell us what you can do for someone that just is concerned about their neck.
Well, unfortunately, I didn't bring the device with me tonight, but
Is it the one you used on Siggy?
yes,
Yeah,
it's-
okay.
They make 2
Siggy Flicker
sizes,
was
one for the
one in
body
the OR and filmed her.
and one for the body. It looks like a violin.
Yeah, exactly.
Bow, and then the other one is a smaller one for the face.
Okay.
So what that does, it tightens up, it liquefies some of the excess fat, and then it tightens up the tissues underneath, and then the external part of it heats up the skin to a certain temperature, and that causes tightening and collagen remodeling and fat remodeling, and it just tightens up the skin. And then there's this new technique called the Embrace technology by
You were telling me
Inmo.
about that. Okay.
So we were using a device called Fractura, which is everybody knows, I think, what microneedling is. The theory is you put these little needles into the skin and it stimulates collagen. But with this technology, it's 24 to 60 needles that go in at the same time.
I looked it up online. I was looking at the little device.
Right. And when it
got a
goes
little-
into the skin, it fires a radio frequency charge, and it tightens up the skin. It heats it up internally from the inside out. So you're rejuvenating the skin from inside out. But now we have the new one. It's called Morpheus. It's an automated technology where it's less painful, and the needle depth is controlled. So if you want to do around the eye area, the crow's feet,
I was reading that you could do it
it
around
goes
the
down
eyes.
2 millimeters. If you're going to the rest of the face, it goes down 3. And then if you're doing the body, it goes down even deeper. And
Okay, so the idea of microneedling is to make collagen growth under the skin?
it stimulates collagen growth.
Okay, but now you're also putting radio frequency in through those needles.
Right. And
Okay.
so what it does, it stimulates collagen. It also, it heats up the tissues and it tightens it up. Mm-hmm.
So someone can do that under the chin if they want
You
to?
can do it anywhere. You can do it anywhere on the whole body.
Okay.
So, we're still, combining it and, we're getting creative with it because now you can mix it with other techniques, So we're using, like, for instance, I had a woman a couple of weeks ago who came in for Botox and fillers. I know she had really bad acne scarring. And I just felt like I had to tell her that we have something for her. And she said she's had everything, dermabrasion, laser. And she's a very attractive lady, and it just was very prominent. So I told her that my plan would be to do the microneedling, the Morpheus, and then we did fat grafting and PRP.
Oh, wow.
So when you mix the PRP with the fat, and we injected it underneath the skin, and then we did the Morpheus externally with one session alone. And we also used the face tight to tighten up the skin too. So we did a combination of 3 different procedures. So the face tight first tightened up the skin, and we did the neck, and then we injected her with the fat and the PRP.
Okay.
And then the final thing we did was the Morpheus, the microneedling, and
How'd it come out?
she was literally in tears. She was very happy. So,
Oh, wow.
So, it might not be the last session we're going to do. We're probably going to do more depending on the severity, but each time you do it, you get an improvement. So, we're coming up with ways to combine all different procedures to get the best results.
Yes, you were talking about hybrid procedures that you're doing, mixing different
Right.
techniques depending on the patient.
Yeah, the good thing about it is now we have ways of doing more patients under local anesthesia. Not that general anesthesia is dangerous or anything,
Yeah.
It's just that
People are afraid of
they're afraid
general.
of it.
I wasn't.
and some-
I like having an anesthesiologist
and,
standing there.
and some of the older patients, you really don't want to put them under anesthesia
Right.
if you can help it. And what we do is we do a lot under local now, and between that and nitrous oxide,
Oh, yeah, you have the nitrous.
and-
That's what you
and-
used on CE when we were in there. Yeah.
it works great. And we're doing a lot more under these conditions than we were with anesthesia. But you have to judge the patient, because sometimes if you do a lot of procedures together, local anesthesia can actually become dangerous. So you don't want to use too much local anesthesia.
Yeah.
So you just have to judge your patient
Right.
and their overall medical status.
So when you get this done, the microneedling with the radio frequency, do they see the results right away, or do you have to kind of wait for?
Well, you actually see it right away while you're doing the procedure, and then they get a little bit of swelling. So the procedure is, the first 3 days, we want them to wear a face mask with some compression for 24/7 as
I
much
didn't have
as
to
they
wear
can.
anything like that.
No, it's because we had it tightened.
Okay.
But this one, you want to have compression. You do that for 3 days, and then, let's say you do it on Thursday, by the time they go back to work Monday, they wear it when they go home or whenever they can. And you start to see the results at the end of the first week. You see it the first day, and then swelling sets in, and then
Yeah,
you
so you
start
can
seeing
see.
them
Okay.
a little bit later. So by 5 weeks, you see a really nice change. And then it takes up to 1 year to see the final results. Because
Because collagen is building?
It's still remodeling, it's still
Okay.
building. And even with laser and fat grafting, it takes up to 1 year before you see the final results. Everything, no matter what surgery you do, it takes 6 to 12 months, sometimes even longer, to see the final results.
See what
But
it's
there's
gonna
still
look like.
minute amounts of swelling and scar tissue. And So, we tell patients in 3 weeks you look good enough for a social event most of the time, but that's not the final result. It gets better and better.
Better and better. Okay. And I know you said you can use this, it's the Morpheus 8, right? Mm-hmm. You can use it on arms too?
You can use on arms.
Bat wings.
Yeah, you could use on the arms, the legs.
Knees. What about knees? Saggy knees. Lots of people complain about saggy knees.
Or some patients, they're in pretty good shape. They've had a kid or two, and the skin around their navel is a little loose, or they have a little wrinkling. This will help with that. And because, what are you going to do for those patients? You're not going to do a tummy tuck for a small amount of loose skin.
Yeah.
And this really helps. So we're still, exploring it and getting creative with with our patients. And that's a huge problem. The knee skin and the arm skin, that if everybody who comes in complains about that, because they're usually thin patients and they live in Florida, and it's inevitable they're going to get that.
Because you've been exposed to the sun. Yeah.
But, it really helps, and we're very encouraged by the results on that. And there's always going to be improvements with technology, and there's things you can do. I mean, it just depends how hard you work at it also and how committed the patient is.
Yeah.
Because you can combine that with PRP, you can combine it with fat grafting. There's a lot of things that you can do. But in general, you can get some great results with that.
Yeah, okay, so it's called the Morpheus 8. And I read it's for face and neck, but also the whole body. And it does fat remodeling. What exactly does fat remodeling mean? Does it mean it dissolves the fat?
Well,
or moves it around?
Well, no, you get some irregular, when those needles go through the skin, through the dermis, there's a layer of fat underneath. So, between the heat and the contracture, it tightens up everything and gives you a little bit more tighter, more uniform surface, of the skin. It just causes a little bit of contracture.
Okay, but you're dissolving the fat too?
A little bit. Yeah. A little bit. Fat is not a dirty word. Fat is your friend. I always tell my patients.
You put it in my face.
Friend. You want fat, and I know my patients are athletic and they're very health conscious. I wish, I had their stamina and their
that's Boca Raton. You see that everywhere.
They are very, very diligent about their health. But I tell them, you know what, you don't want to be the weight you were when you're 18, when you're in your 50s or 60s, or even your 40s. It's not going to look that good. You need a little bit of extra weight because you're going to look better. It's like putting filler all over your body. Right. So it's not fat is not a dirty word. It's good to have fat, but just the right amounts in the right places.
And explain to my viewers and listeners, when you graft fat, like you take it out of my stomach, you have to treat it first, right?
Right.
Why do you have to do that?
Well, because there's oil in the fat. Some people have more oily fat than others. There's difference in the qualities of fat and also the locations you take it from. So you have to separate the oils and from the fat, and behind it, what you want to leave behind is the actual live fat cells.
Okay.
And the stem cells also.
Okay.
So once we separate the
How do you separate them?
Well, there are different techniques. Some people spin it. I prefer to rinse it and filter it because I think that it's a better way. It doesn't disrupt some of the fat cells, and I've gotten my best results with that.
Okay.
And when I do fat grafting, I usually do it at the end of the surgery. So once I'm done with everything, we take out the fat and we immediately put it back in because the cells are still fresh and live.
Yeah.
So we don't want to have it sitting out for a couple hours.
Yeah, and I know with some doctors there's a lower percentage that takes, and that might have something to do with that part of the procedure.
I think there's a lot of factors to that. Technique, of course, is the most important. Has to do with the way you inject it. You can't just shoot, like a lot of patients say, well, can the fat move down all the way here? No, it doesn't, because you don't just shoot a big blob. You have to put it in very small microtunnels.
I didn't know that.
With a small cannula, and you go back and forth, and you have to get in the muscle, because the muscle is very rich with blood supply.
Okay.
And
then once it's in there, it's permanent?
It's permanent. Some of it will resorb. So the key is you have to overcorrect a little bit. And, when I put it on the face, I always get this comment later. Actually, they go, I don't want my lips to look too big. And when they come out of surgery, go, oh, my lips are big. And I'll say, trust me, 100%.
So you look like that out there.
At the end of 3 to 4 weeks, you'll say, I liked them. I wish you put a little bit more.
So you're using fat grafting into the lips, too?
We're using the lips, too.
Okay.
Yeah.
Okay.
Yeah.
Wow.
We put everything. We put the filtral columns. We just, if you look at a youthful face, you'll see, even men included, when they were younger, they had fuller lips. Mm-hmm. So having a fuller lip, and I'm not talking about huge lips. I'm just talking about getting back to the way you were. And what I always tell my patients is what you're looking in, when you look in the mirror, you're not seeing the real you. The real you is that photograph up there. So it's sometimes that, especially the ones that let themselves go too far, they get shocked when they see what they look like afterwards, and then they take some time to get used to it.
Oh, because they're not looking at themselves.
And I'll say, listen, this is not you. Yeah, you're used to someone that's not you. This is the real you. And I put their picture next to them. They say, yeah, you're right, But
wow.
But it looks, it's a very pleasurable experience to see.
People
that.
are always happy. Yeah. I know you've done several friends of mine, and they're all very happy.
Oh, I get a kick the next morning when I see them, and the bandages are off, and
I know there were no bandages.
Sometimes we'll keep a bandage on for the first night. Mm-hmm. So usually with the full, some patients go home the same day if we're just doing, let's say, a lower face. Yeah. But if we're doing the whole thing and we keep you over, we put a bandage on the first night just to make sure there's compression and make sure you minimize bruising and bleeding. And then the next day we take them off, you get your hair washed, and you go home.
So you leave and you have nothing. It's
nothing.
Like, yeah. You're not walking around with a big, bandage all around the head.
No.
Okay, we're going to go to break here. And when we come back, we're going to talk about some more procedures you do, particularly the PRP hair restoration. I want to talk about that. Okay. And we're going to show you some pictures. Okay, we'll be right back.
You've been listening to and watching The Becky and Boca Show. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand building in Boca Raton. The number again is 561-409-4065. And now, back to the show.
Hello, welcome back to the Becky and Boca Show. I'm here with Dr. Art Handel, and he's been telling us about all the interesting techniques he does so we can all look younger or better or whatever, look as good as we feel. So you have been telling me that you're getting excellent results on both men and women on hair restoration using PRP.
Correct.
And I watched you do that on one gentleman, remember? Joel? And it was amazing. And he's out in California, but he sent us both pictures. It was incredible. But now you told me that you're doing it on women now, and it's making a big difference.
If you look at anybody as they get older, even if they have a full head of hair, it's never as thick as when they were younger, men or women. It's very rare to have somebody always have the same amount of thickness. Mm-hmm. So, it's a major problem with patients because it has a lot to do with diet, chemicals in their shampoos, all kinds of treatments that they're getting, and it's hormonal too. So a lot of women are thinning out as well as men, and
and it's devastating for a woman when she starts to get thin hair.
And I've seen some patients that I never used to think there's much you could do about it, and then PRP came along, and I was skeptical about it. And there's different types of techniques. One, you could just separate it from the blood cells. You spin it around.
So you're taking blood out of the patient and spinning it out in a centrifuge?
Right. Okay. And then you take out the platelet-rich plasma and you inject it. But that doesn't work as well as what we're doing now. It's called PRPFM. So it's a matrix. So it's a special tube that we acquire. After you spin the blood, you mix it with this gel, with this compound. It's a matrix, and it's liquid still. But you have to inject it with a certain amount of time because it becomes a gel. So the idea about this is if you just inject PRP straight up, it doesn't last that long. Your body will kind of wash it away. But if you use the PRP-FM, it works really well because it stays there.
And that's when you've been seeing all these results on.
Yeah, and my brother's an orthopedic surgeon. He does it in combination with stem cells for joints, so hips, knees, and he's getting great results with that too. But I'm a firm believer in it, and I'm even surprised how quickly we're seeing results, even one treatment alone.
Does the hair get worse before it gets better? Because I've heard people say that about other techniques.
I haven't experienced that. No, I see it. Not only does it come out, not only do you see hair growth, you actually see the texture of the hair improving.
Oh, wow.
So we actually did a younger woman who had 2 children, and she's in her 40s, and she noticed after her last pregnancy that her hair was thinning, and she got PRP. I said, let's try it with the PRP-FM, and I saw her yesterday, and she said, it's only about 3 weeks, and she said that not only does she feel like her hair is thicker, but the texture is different.
Oh, wow.
So it works, and I've used it on a lot of patients already. PRP-FM.
Okay.
So, and...
so if there's a woman out there watching whose hair is kind of thinning, you would do what? You bring her into the office, and how long does it take? And
well, you have to draw the blood,
anesthesia or anything like that?
And then you have to spin it for a certain amount of time, I think like 15 minutes.
Okay.
And then you mix it with the matrix.
Okay.
And then you inject it. And
like all over the scalp?
All over the scalp, and it's pretty painless. We have a device that vibrates while you're injecting it.
Yeah.
And it's very, very comfortable. And let's say on a male, if you look at their head and it's shiny, bald skin, it's probably not going to do anything.
Okay.
But if you look real close under magnification, you see little dots where the hair follicles are.
Oh.
There's a good chance that you can re-stimulate them.
Okay.
And, you might not get the thickest head of hair in the world again, but at least it'll preserve what you have. It'll grow whatever it can grow. And then you could combine it with hair transplants if you want, or at least carry you on to the next level when something better comes along. So people are actually injecting stem cells into the scalp. I haven't done it yet, but we're looking into that.
And what would that do?
It helps with hair growth also.
Okay.
But I like to see the data first and see some cases before I actually start doing it, because I want to, try to deliver your patients a result.
Right.
And the other thing is you have to use it in conjunction with vitamins. And
okay, what are the vitamins?
Well, there's 2 different vitamins. One is Nutrafol and one is Viviscal.
Oh,
and
Viviscal,
there's a medical grade one. And, the basic vitamins that you can get, if you don't want to buy these type of vitamins, are biotin and zinc and the B-complex vitamins. So that's good for hair growth. But there are other ingredients in these vitamins that help. And I also recommend Rogaine. I think Rogaine also stimulates hair growth. So if you use everything...
So you do a combination?
Yeah.
Okay.
We try to do a combination, and, but I think the key thing is the PRP. I think it definitely works.
Wow, so you're impressed with that. That must be...
Yeah.
Wow.
Oh, yeah.
Okay, so for men and women, that's been working.
For men and women.
Okay.
Yeah.
That's really good, because I know a few women that they even have to wear hair pieces because they can't...
right.
And in this heat and humidity, that must be awful.
Some people just have naturally thin and fine hair.
Yeah.
But the problem with those patients is that if they start to thin out a little bit, it's more noticeable than somebody who had thick hair to begin with.
Right. Okay.
So.
Okay. What else are you doing? I know you're doing a lot of these arm lifts. It's mini brachioplasty combined with radiofrequency tightening. So you do a little bit of surgery.
That's a big issue. I mean, with the clothing that women wear down here,
it's hard to wear long sleeves in the summertime.
It's a big issue. So the biggest complaint that we get is the loose skin
right
underneath.
Under here.
Right. Yeah. The second one is the crepiness in this area. So we assess the patients. It depends what the situation is. If they have if their arms are hanging down like this, it's a combination of liposuction and probably surgery.
Okay. And Freddie, I know you have some pictures of arms back there, so if you can pull those up while he's talking, that would be nice.
Yeah,
Okay.
so it depends what kind of surgery. Like this one,
Okay.
that was just body tight
No
and
surgery.
liposuction, no surgery at all.
Oh, wow.
Could it be tighter? Yes, it could be. But that patient's happy with that result. Local anesthesia, no surgery, no incisions.
So if you wanted to make that tighter, you would have to go for surgery.
Right. Now, there's two types of surgery we can do. We can do the full surgery where it goes right straight down from the armpit to the elbow, and that gives you the absolute best results.
Okay, here's another one.
Okay,
Oh, that's a huge difference.
that one was the full surgery.
Wow.
People complain about the scars, but if you're very meticulous with the incision, that incision fades.
Yeah.
I don't like to call them scars. I call them incisions.
Okay.
You don't have a
Right.
scar
Scars
until you
up,
get
yeah.
a scar. So what we do
If
is
you got a scar, that's
we
not
get
good.
it to heal, and we have ways of, I encourage my patients to come back if they see something looking a little angry, because if you wait too long, then it
Yeah.
becomes an issue. But if you do it right away, if you treat it with a little cortisone or a little IPL,
Yeah.
you can make those things disappear.
Go
And
away.
it's always risk versus benefit. What do you rather have, arms like this or really tight arms? An incision that's hidden here that you're not going to see unless you focus on it. And after a while, you don't really see them. But
Fades.
we're doing incisions just in the armpit, too. So sometimes we combine body tight.
Oh, so you wouldn't even see that.
Yeah, you could do body tight and get it as tight as you can, and then we go into the armpit. So now my procedures with the longer incisions are very rare. So if we're doing somebody who has pretty much of an excess, we do just the arm and the armpit
So you're saying
incision,
you go in through the armpit.
the armpit
So you wouldn't see
incision,
any scar
nothing
here.
there, and then we do
Okay.
body tight. And then for the crepiness here,
Yeah, what do you
that's
do for
when
that?
you use the Morpheus or the microneedling, and then
Okay.
and then you combine everything. So it's like
Yeah.
a hybrid surgery. You do a little bit of everything to get the best results.
Wow, amazing. And when we had Siggy Flicker in the OR, which one of these procedures was that?
That was body tight.
That was body tight. Okay.
That was body tight.
That was the one that looked like a violin bow.
Yeah, like a violin bow.
And you went
The
in underneath her skin with one, and then
on the outside, it was the external attachment, which heats up the skin externally, and the internal attachment, which heats the deeper tissues and causes skin contraction.
and then you kind of
liquefies
pull that
some
back
fat.
over the
Right.
Yeah, she did really well.
She did very well, yeah.
And you used nitrous oxide for that, I think.
Nitrous oxide and a little bit of,
Okay.
pills.
She talked a lot about Trump in the OR, but she was very comfortable. Remember that? I went in there with the cameraman and recorded it. She wanted us to, and it really turned out well. She
Yeah.
did it for the what do you call that? Back fat,
The back
raw
fat, yeah.
yeah.
Yeah, we're getting some great results with that. So, these are things that I embrace because, patients were asking for a solution to that. And we always talk them out because you don't want a scar there. Because sometimes when you have excess skin.
You know, on the back here?
Right.
Okay.
You don't want to excise skin. So we're getting, we're able to tweak things better now with this type of technology. And even people who were doing great with just liposuction alone, now you're even into a better category, or male gynecomastia.
Because you did use liposuction on her also, right?
Yeah.
Yeah.
Well,
okay.
you have to do liposuction in conjunction with this. And
Yeah.
we're doing now the gynecomastia, the male breasts.
Right.
That's another thing. And so that's a life-changing operation. So, it's,
Especially in Florida, it's hard to wear. You got to wear thin clothing.
Oh,
So if
yeah.
you're a guy that that has breasts, that's a problem.
No, it's
Yeah.
it's a big problem, and this is an answer to that without any skin excisions, and it just helps. It just fine tunes your procedures.
Yeah. Yeah. Okay, so what's the most popular procedure you do? Facelifts?
My practice right now is great because I like doing everything. Because it kind of gets boring to do the same procedure all the time. So
Yeah.
50% of my practice is faces, and 50% is what I call mommy makeovers, and about
What's that? A tummy tuck and breast
tummy
lift?
tuck, breast reduction, breast lift.
Yeah.
And, I treat my body work just like a face. If I'm doing a tummy tuck, my patient, I'll say, what kind of bathing suits you like? Oh, I'm never going to wear a two-piece. I said, well, why are you getting this operation?
Yeah, why are you doing it?
we do a G-string incision.
Okay, so
And
you don't see any.
you don't see anything. And then
Okay.
while it's healing, some patients, when the day after surgery, you look at the incision, it's like nothing. It's like a hair. like a hairline. But it depends how that patient's going to heal. Either they go towards redness or they keep on continuing. So we have ways of keeping them on the right path.
So if it starts to get red, they would come back to you and you'd do something?
Well, we can inject them with a little cortisone, but right now we got the IPL, so intense pulse light or microneedling, so that all helps. And, it might take on some patients a year or so for all that to fade, but with this technology, it fades quicker.
Yeah.
So we get them in that incision-free zone pretty quick. So eventually, over a period of years, you don't even see it. It'd be like, sometimes you have a hard time finding it.
Wow.
But there's nothing wrong with having an incision if it just heals the right way. And you just keep after it. You can't let it go. You have to come and see us. Our doors are always open. Anytime there's a question, my staff lets me know. They'll call me even in the operating room. I'll say, better safe than sorry, bring them in.
Yeah.
So we like to see everybody, especially the first few weeks, make sure everything is going in the right direction, because you don't want to let anything go, because that's when you can have some issues.
Right. And I know you have a big, beautiful building there on North Federal Highway, and you have a surgery center, right? And patients can stay overnight if they need to?
We have 2 fully licensed operating rooms, and we do orthopedic and plastic surgery there. And then...
Your brother is an orthopedist?
Orthopedic. Okay. And we have an overnight facility for patients who I feel require to stay overnight.
Which patients would those be? I know I stay overnight.
If it's somebody who's having a tummy tuck, I like to keep them overnight. Somebody with a full facelift and brow and the whole shebang, I like to keep them overnight. Or somebody having multiple procedures, someone who just doesn't want to go home that night, they can stay.
Yeah.
So, we have a nurse that stays with them. They're the only patient that needs,
nurse takes care of.
Nobody else will have that kind of attention.
Yeah, no, that's great. That's great.
So it's something that, it's a commitment that you make, and you want to make it as pleasant as possible, as painless as possible. And there are ways of doing that.
Well, I can tell you there was no pain.
No.
You told me there wouldn't be, and your staff told me there wouldn't be, and I didn't believe it.
People don't believe it. I tell them the worst thing is you're going to look horrible with the laser. But as a matter of fact, you have numbness. I even tell the men, buy an electric razor, because I don't want you to cut yourself, because you're going to be numb for a while.
Yeah, I remember that.
And but it's a pretty pain. Even the tummy tucks are pretty pain free.
Really?
We're using Exparel, which is a long-lasting anesthetic, local anesthetic. It lasts between 2 to 3 days.
Oh, so even after they leave the OR, it's still working?
Oh, yeah. Oh, yeah.
Okay.
I mean, when I inject it during surgery, my anesthesiologist tells me it's amazing. He goes, I just had to cut back on my anesthesia. As soon as you injected that, the pain level went down. They back off on their anesthesia. It's fantastic.
Oh, wow. Okay. And then by 2 or 3 days, it wouldn't be that painful anyway?
No, and then, you could take, some patients just take Tylenol, but we give pain pills. And, if they need it, we give a muscle relaxant. So there's nothing wrong with taking a little medication if you need it, but you don't require that much.
Okay, so what are all the different kind of surgeries? I know you do breast implants, you do faces.
I love, I do a lot of revision. Right now, I would say probably 40% of my practice is revision work.
And what do you mean by revision
redoing
work?
surgeries, patients who've had complications
who've had other surgeries and they need to be fixed.
Yes. Okay. And especially noses. We see a lot of...
Noses are difficult, but you do a good job. I've seen your patients.
I love nose. I love a nice natural nose, and we're seeing patients. We do, noses are very tricky, because a nose can look good 2 weeks, 3 weeks, a month out, even 6 months out. If you look at them 2 years later, you'll see changes in them. So,
why? What happens?
Well, a small amount of swelling on the nose is like a huge amount of swelling on your body. So, swelling really hides all the details, and when the surgeon is doing these surgeries, it might look great while they're on the operating table, and then when you look at them, a few months later, it looks too small. And it also has to have the nose
has to fit the face.
And it doesn't just look good; it has to function well. So,
right, it is.
So sometimes when you're making a nose, when you're smaller, or you're doing a rhinoplasty, you can actually have breathing issues. So we usually prophylactically prevent that. So we use a lot of cartilage grafting. And, so we want it to function as well as look good. And even though you might see a dramatic result with the post-op compared to the pre-op, it looks natural. So I usually try to tell my patients, when you're done, you won't look like you had a nose job, but when you see the pictures, you'll see a big difference.
Yeah, yeah.
So
you don't want the nose that's too small for the face. You see that a lot.
No. Yeah. And it's got you have to give them the nose. You have to kind of imagine the nose they would have been born with.
Yeah.
So, and what goes with the rest of their face.
Right. Okay. Anything else new you're doing? Did we cover all your new techniques? I know you're doing a lot of body and skin tightening.
Yeah, that's the, I'm not really big on technology because a lot of it doesn't work or doesn't deliver what they say it's going to deliver. So apart from my CO2 laser, this is the first technology that I got excited about. And it works really, really well. And it has to, it's also how you use it and patient selection. So
what do you mean by patient selection?
You just have to know who it'll work on. Like if somebody comes in for face tight and their skin is really thin, very crepey, they have a lot of loose muscles, it won't do much.
It's not gonna
you
work.
might get a small improvement, but in my opinion, you don't want a small improvement. You want
what would you do for someone like that?
Facelift.
Okay.
That's a facelift, yeah.
Okay.
And you just have to pick the right operation for the right person. And
do you find people are afraid of facelifts and they want to do anything but?
You know what? I think it depends on the person. I think
because I have so many people that come to me and they say, I want to fix this, and this, but I don't want to do surgery. And I'm like,
they all tell me I don't want that. I'm afraid of a face. I don't want that tight pull.
Yeah. Oh, everybody says that.
So I tell them, you know what? It doesn't matter how tight you pull it. It's the direction of the pull.
Yeah.
So if you don't tighten, if you can't just tighten a face as much as you want. If you tighten a face too much, you cut the circulation off.
The skin will die.
The skin will die, or you get bad scarring. The key thing is, like anything, when you put together something, it's got to go back the way it was.
Back the way it was.
So why would you do that to a face? And especially on the hairline, you never want to disturb the sideburn.
That's another thing. A lot of people are missing their sideburns. That's like a key. You can see.
That's the key thing.
See a woman with those sideburns, you know what she did.
And then when they smile, you see these lines going up this direction. That doesn't go up this way. It goes down this way.
Okay, so they pulled them the wrong way.
So it gets pulled up.
And what's it with the side? They just cut them out so they can pull?
No, when you make the incision here behind the sideburn to pull up that skin, it just goes back too far.
Okay.
So you elevate the sideburn, and then the skin here starts to look too wide, so it's not a natural look.
That's that
from
look.
the corner of your eye to the sideburn starts looking too wide.
And where do you put the
incision?
Stitches? Yeah.
I usually go under the sideburn, inside the ear.
Inside the ear.
And on the back of the ear.
Okay.
Not really in the crease, like on the back of the ear.
Okay.
Because that skin tends to heal virtually scarless.
Okay.
So, once in a while you get somebody that, you need to do a little touch-up or a little tweaking. Sometimes a hair follicle, when it's growing back, can cause irritation. That's why I say it's always important we follow our patients really closely. And if I see something, sometimes they won't even notice it. And I'll say, hey, you know what, I don't like that. Why don't you come in, we'll just zip it out under local anesthesia and make sure it looks
and fix it
perfect. Yeah. Because, I want my patient to be able to wear their hair up or in a ponytail or especially short hair.
In Florida, yeah. You got to be out and around. So, what do you think is going to happen over the next few years and all this this new technology? You think eventually people won't even have to have surgery? No,
I think there's always going to be. I can't see a robot doing a nose just yet. Maybe 20, 30 years from now. Somebody told me if you can imagine it, it can happen.
Right.
So, but I think the key thing is these technologies that are tightening skin and improving skin texture. I think stem cells are going to be a key thing.
What are you doing with stem cells now? I know you told me your brother's using them too in orthopedics.
Yes.
But how do you use them?
We use them. Well, the stem cells are being used for, facial rejuvenation or hair. I haven't used.
So you're injecting them in the face?
No, we haven't. That's something that's coming out now. The stem cells. That's something that's recently been made available. The stem cells. So I haven't. We're looking into using that in our practice, incorporating that. But the fat grafting does have some stem cells in it because fat is mesenchymal tissue. It produces all kinds of stem cells. So it's well documented that it has stem cells. It has some great benefits. So, but as far as technology is concerned, you're looking at all these skin tightening and laser technologies. But if somebody has a lot of loose skin, lasers, I mean, you're going to need surgery for that.
Yeah, you got to
So,
get rid of it.
so it's we're still years away from perfection, but who knows? I mean, one of these days, the key thing is doing it while you're young, and while it's not.
So
while
when
it hasn't
should someone?
advanced.
At what age should someone?
Well, I can imagine someone.
We're not going to talk about my age here.
Well, I can imagine somebody in their 30s or 40s starting to get some microneedling with radio frequency before you get a lot of laxity.
And you think that'll hold it back?
So you're just tuning it up, and then you're rejuvenating the skin. It's all the key is elasticity. That's why you'll see some people in their 60s and 70s. They still look great because of their genetics. They have good elasticity. They have a lot of oil in their skin. So that's why it has. But that's why they look younger longer. Is the elasticity? It's when you lose the elasticity, and these devices can help preserve that and enhance your elasticity. Mm-hmm. And if you do it incrementally over the years, you'll get, you'll have less problems when it comes time to having a real procedure.
Mm-hmm. Okay.
But
one more quick question: the bones of the face, do they start to dissolve at a certain point when you get older?
Not really.
Like the bones in the rest of your body?
Not significantly. I mean, what happens is the soft tissue starts sliding down. It's almost like someone's face is melting.
Ooh.
So when you look at somebody with jowls, I tell them, you're not growing fat here. It's just that fat
sliding down.
belongs up here.
Yeah.
So there's a muscle that goes from here all the way down to your collarbones, one long muscle. On top of it, there's fat and muscle, and it starts sliding down this way, and then the muscles in your neck, they separate into two bands. So what we do is we tighten these bands. You tie
them together, right?
You got to tie them in the middle, and then you pull this up. And
that's like the two most important things to do with muscle?
Right.
So you do the muscle first. So you put these two together.
And then you do the muscle first.
That up.
You do all the muscle work first, because that's what's really holding up your face.
Right.
You just tighten up the skin. It may look good for a while, but a very short time. And you'll see these bands coming back very quickly, and the jowls come back, and it's not going to be a long-lasting or a full result. And you want that cheekbone elevated. You want that full cheek.
So when you pull this muscle back,
right?
That pulls up
when
the
you
cheek.
turn your head at a 3/4 view, this cheek should look like a little bit of an apple. It should come out with a little bit of a roundness.
So is that the muscle you're looking at?
Well, it's the muscle that's been elevated with the fat layer on top of it, and then we enhance it with your own fat. That's why we look at the pictures.
I love the fat grafting.
And then you put the fat in there, and that's when you really get the results, because you're doing. That's why when I was training, our professors would say, "Hey, take the pictures a couple of weeks later, because that's when they look their best."
And they didn't do fat grafting until
no, they started doing it in the 80s, and then they gave up on it for a few years, and then
why was that?
Because they didn't think it lasted.
Okay.
But because they gave up on it too soon, and then some surgeons really, investigated and stuck with it, and they proved that it does last, and you can get great results with it, and then it caught on, and, so now it's virtually in every practice.
Yeah,
I mean, they're doing breast augmentations with fat grafting.
With just fat?
Yeah.
Wow.
I don't, some patients are afraid of implants, or they don't want implants, but I don't really care for that procedure for breast augmentation, because most women who come for breast augmentation, they don't have enough fat to donate.
To take it, yeah.
And having it symmetrical, and, how are you going to judge how much it's going to take on one side as opposed to the other side? And then let's say you've used all their fat up, and one side is...
Then what are you going to do?
What are you going to do? But the only patients I like to use that on are breast reconstruction patients.
Okay.
Or I use it on patients who've had bad liposuctions or dents or divots. So it's like body filler, body bond. We just put it in there, we fill everything up. And the other thing about it is, if someone, let's say, comes in for a breast lift, and they have a lot of fat to donate, instead of using an implant, we'll put some just in the upper part of the breast, because that's what they don't like. I try to explain to patients, natural breasts are not always up here. an implant is always sustained, upper pole fullness. So you put an implant to maintain that upper pole fullness. But with fat grafting, you do the lift, and then you put a little bit of fat in that upper pole. Yeah.
Interesting.
And then
Wow.
and then you could even it out. And even if they need more later on, at least you have some more that you can.
Then you can go back in and do it again.
Yeah. So that's those are the kind of patients I like to use that on.
Yeah. Okay. All right. Anything else you want to say here? Your practice is located. What's your address? Do you know it?
5503 North Federal Highway.
North Federal Highway. You're just a little bit north of Yamato Road.
On the west side.
On the west side. Big, beautiful facility there. Very nice place.
My home away from home.
Right.
Spend more time there than home.
Okay, so if anybody is interested in any kind of tweaking, whether it's the face, body, you do just about everything there.
Yeah.
And you also do things like Botox and fillers and
We do that.
That kind of stuff.
Usually on our patient days, which is Wednesdays and Fridays. We do fillers and injectables, liquid facelifts, we call them.
liquid facelift. Okay.
Yeah, so those are, there's a whole gamut of fillers and different types of neurotoxins we can use.
Okay. All right, we got to go. Thank you very much, Dr. Art Handel, my plastic surgeon right here in Boca Raton. And I will see you next week. Bye-bye.
Take care.
You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed